I want you to know that in the Cowichan Valley, we've got roughly 80,000 people, and that's outside of the boundaries of the Cowichan Valley for the purposes of MLA. I'm talking about the regional district. We've got 8,000 people, or 10%, that are aged 65 or older. More than 6,000 of them are over age 75. And since 2001, the population in the Cowichan Valley aged 75 to 84 has increased by 15%. So there's an area where we really need healthcare help. The population aged 85 and over has increased by a total of 43%. In the Cowichan Valley, the aging population is increasing at a much faster rate than either the overall Viha region or the province as a whole, Honorable Speaker. The Cowichan Valley has the province's highest per capita ratio of people with diagnosed physical, mental, social, special needs challenges. Okay, those are the facts. The Cowichan Valley has established track record of being a community-minded, creative, and tenacious problem-solving social, mental, and physical health challenges. They come up with innovative ideas right there in the Cowichan Valley, and they do. And the minister is right about another thing. We've got some fantastic people within the healthcare system that do outstanding work for the province of British Columbia, and I join in commending those folks for the outstanding work that they give. However, in the Cowichan Valley right now, there's a high need for additional residential beds for frail seniors, and that's after they closed the Cowichan Lodge, which was a disaster, and of course we've got the Ombudsman report on what a disaster that was, and that was political shenanigans. If you've ever seen jiggery-pokery, there it is, trying to shut down a publicly owned facility, providing some of the best care you could find in British Columbia, rose gardens, all these wonderful things, and they shut it all down so they could contract it out and give it to a for-profit facility. And at the end, we've got all of the publicly funded residential care facilities in the Cowichan Valley are full, and they have been for more than 8 years now. There is a high need for additional transitional care beds. We've got people sitting in hospital often that should be in a transitional care bed. We've got a high need for dementia and gentle care programs, for respite care beds and services, a high need for caregiver support services and programs, and high need for hospice and palliative care beds, for all-day adult care programs, for incontinence management clinic. We need an effective chronic care management plan, falls prevention plan, speech language pathology. A lot of things like that are necessary, Honorable Speaker, with whether it's heart attacks or whatever. There's always a need for some of these programs, and it's becoming tougher and tougher. And there is a high need for better, faster, and more locally available services for people who are on the autism spectrum disorder. And as I'm sure I've said before, I have a grandson, Gabriel, who is a wonderful young man now, 14, and he's got autism, but very special indeed. I am appreciative of the help that he did get, but that funding has been dramatically reduced, and what's been available has changed dramatically, certainly in schools, the ability to get the help he needs.